Hi, welcome to the first of what I intend to be many informative interviews or discussions about various research articles related to musculoskeletal conditions. My name is Matt. I'm a chiropractor here at Riverside Chiropractic, and I wanted to address first something that is really common in presentations for acute low back pain. And this begs the question, well, what is low back pain? Fortunately, a group of researchers recently asked this question and published really the magnum opus of low back pain research, which we're going to discuss today. And hopefully in the future, I'll have a chance to interview some of the authors or some of the researchers at the periphery in this area. But this article is by Jan Hartvigsen and colleagues, and it asks the question, what is low back pain and why do we need to pay attention? I'll put a link into the notes below. But essentially, low back pain is a symptom. It's a symptom of pain and discomfort rather than a diagnosis. And the reason for that distinction is actually quite important. We say that because in low back pain, believe it or not, the best research sort of suggests 90% of low back pain, we can't really locate a specific cause of their back pain. Now, this may be changing in the future. It's based on the best, most up-to-date research as of 2022. But for the most part, pain is considered today to be an output of the brain based on nociceptive drivers coming from your back. Now, what does that even mean? Or I should say low back pain. This is all in the context of low back pain. Well, what that means is if you come into a clinician, whether or not that is a chiropractor, a physiotherapist, a GP, a different type of practitioner, a structural cause for your back pain will be insufficient. You may wish, and we know this from qualitative research studies where they interview patients and ask them what do they like and what do they dislike about their diagnosis. Unfortunately, patients really want to know the cause of their pain. And the harsh reality is that low back pain is considered a biopsychosocial problem. That means that there will be biological drivers, nociceptive tissues that can be irritated when you do a specific move. Say you're moving furniture around and the next day or even right away you start to notice some discomfort in your back. Usually because there's some sort of tissue irritation, tissue damage to one of about 5 different types of tissues in the back, followed by what we call your psychosocial profile. So that means your psychology is going to play a role into this. How are you sleeping recently? How are you dealing with various types of stress in your life? Are there other stressors? Different relationships that may be breaking down, or perhaps someone else is unwell, and this is starting to also affect you. There are also other, many things that can be playing a role, such as comorbidities, depression, anxiety. These are more common in people with back pain. There are also things that people do in terms of their lifestyle, such as whether or not they smoke or exercise. And lastly, there are things such as your social environment that you're in. What type of work do you do? What's your role in family life? Are you alone? Are you in a very connected community? Depending on your really biopsychosocial profile, as well as your past history and genetics of background pain levels, all of these can play a role in how you are going to respond to an episode of back pain. So that is in a nutshell, what we're going to be exploring a bit more: the biopsychosocial nature of back pain, as well as some of the things that we know are helpful, and some of the things we know that one should avoid. So I hope you found that useful. My goal with these little updates is just to give you a little bit of information so that you can be a bit more informed about the nature of various conditions, and I'll try to update it as new studies come through. But today, I think that's a good little bit of background on what low back pain currently is considered. That is a symptom. And secondly, what it is that we can say about it, which is most of it is about 90% of it is considered nonspecific. And then the last 10% are usually due to more serious underlying causes, things such as underlying malignancy or cancer, infection, or some sort of fracture. But that's the rarity. Even though one may be experiencing quite a bit of discomfort or pain, for the most part, 90% of low back pain is considered to be not serious, although it can be very painful and disabling. In fact, we know that low back pain seems to be the leading cause of disability in pretty much every country, both developing and developed in the world. So, that's it for today, and we'll be updating these as we go along. Thanks.